In the United States, we spend nearly 20% of our GDP on healthcare. That's money that doesn't go into education, infrastructure, defense, a bunch of other places that it could. Imagine if 5 years from now, we were able to drop the amount that we were spending on our GDP to 12%. I'm just making up a number. And imagine that lifespans went up. People had easier health systems to navigate. They felt more empowered by their ability to deliver care. And this coming wave of retiring baby boomers, we were actually able to care for with a workforce that is able to now expand to a much bigger place. I mean, that would be miraculous. And I think that's what we have to aim for.
Welcome to A&M Healthcare Industry Group's What's Your Moonshot podcast series, where world-class healthcare leaders seek to solve big problems. Listen as we talk to today's health system CEOs about the journey to achieve their moonshots.
Welcome to A&M's What's Your Moonshot podcast series. I'm Chris George, a managing director in the Healthcare Industry Group and leader of our health system practice. I am co-joined by my host, the Honorable David Shulkin, 9th Secretary of the U.S. Department of Veteran Affairs and an A&M Senior Advisor. Today, we're happy to welcome as our guest, Dr. James Whitfill, Senior Vice President and Chief Transformation Officer at HonorHealth. In this role, Dr. Whitfill connects information technology, analytics, marketing, clinical informatics, and enterprise project management resource functions to enhance the patient, consumer, and caregiver experience. Welcome to you both, and I'm looking forward to a great discussion.
Thanks, Chris. It's great to be here.
And great to see you, Jim, and Chris, of course.
AI has the potential to revolutionize healthcare. We're hearing a lot about it in our travels in the market, offering transformative solutions that can significantly enhance diagnostic imaging, streamline operations, improve patient outcomes. The opportunity to integrate AI into imaging presents a unique and powerful way to elevate care delivery to new heights. Can you describe your moonshot vision for taking AI and imaging to the next level of the possible?
Chris, it's a really good question. And one of the things I think is interesting about the concept of imaging in healthcare is imaging was really our first specialty to be digitized. If you think back to the late 90s, it was really before we had EMRs across the United States, we had PACS systems that were developed. And in a similar way, we've been deploying AI technologies in the diagnostic process for radiologists since probably Jeff Hinton's famous statement back in 2016. And so we've gotten a lot more data in that area. And so what I continue to see, and this sort of informs sort of my thought around AI and healthcare as a whole, and we'll talk a little bit more. There's both incredible promise, for example, maybe reducing the amount of false positives that we see in mammography. And we know that a false positive mammogram is a psychologically devastating thing for a woman to go through. So if we can make that better and not change our cancer detection rate, that's huge. If we can not miss, life-threatening findings such as intracranial hemorrhage, pulmonary embolism, these kinds of things. And yet, what's interesting about AI so far is, again, Professor Hinton said we would probably not need radiologists in 5 years. Here we are, and there's a massive radiologist shortage. Part of that's we're creating more images. So what's the quandary? The moonshot is, how do we figure out how to use these technologies so that we can deliver more care at a higher quality, lower price, and it doesn't put more burden on our nurses and our physicians? That's the moonshot.
So Jim, let's go back to this. The issue of identifying imaging as a target for clinical AI makes sense. We knew that computers would be good at pattern recognition in imaging and pathology. That's been around for quite a while now. There's actually been FDA approved applications in imaging and in pathology, yet we're not seeing widespread adoption in the United States. And, if you had asked probably Professor Hinton 5 years ago, even longer, what would you be more likely to see, a self-driving car or a radiologist using AI, they would have probably picked the radiologist. But, I just came from San Francisco today where there's lots of self-driving cars out there, these Waymos, not too much radiology-led AI. So what's the holdup? What's the barrier? What are you doing at HonorHealth that's making this work? Is it related to reimbursement? Is it related to quality? tell us about how it's going.
So I would say what we're doing is we're trying to recognize the fact that somehow as an entire profession, as physicians doing clinical practice, we can't figure out at scale how to make AI work. And I have a lot of hope. Like, I want AI to work. I want our clinicians to have a better experience. But for some reason, for example, interesting paper that came out in literature about a couple of months ago out of China, radiologists who used AI in that setting had more burnout if they used AI, and the bigger their workload got, the worse their burnout was. That's completely opposite to what we would expect. But it begins to give this echo how back in 2010, we thought as we adopted electronic healthcare records, that should make the health system in the United States more productive, more efficient. Not sure we got that. If anything, now we have clinicians complaining about the additional burden put on them. So there is this paradox of how technology that creates value in other industries, when we do it in healthcare, sometimes we get paradoxical effects. So when our radiologists are using AI, and so what we're trying to do is trying to have the data speak to us. When we find, for example, incidental cases where the AI appeared to pick things up that the physicians didn't, trying to back that up with a clinical review of the chart to say, how did this change the patient's care? Because you could imagine two very different folks. If we found an incidental finding on something and it made the difference between life and death, let's make it extreme, that's a huge win. If it turns out the patient was, incredibly sick already, we were going to bring them into the hospital for all the same treatments, maybe all we did is we just gave, another problem on their problem list, but we didn't really affect their care. So we're trying to look at the clinical outcomes, not just the anecdotal cases of how well the AI worked in those spaces. And I will say that at this point, we're not, just like you said, we're not seeing the wholesale, wow, this is completely changing the way that we're practicing medicine, or patients are having a different clinical experience. I'll end by saying, I don't think that means we quit, because the reality is the US healthcare system produces incredibly erratic outcomes at high cost. We have to find solutions. AI is probably one of the most likely ones. And just because we haven't figured out how to introduce it into our workflow, we just need to take a fresh look at how we do that.
Yeah, oh, it makes total sense. There's been a lot of advances, right? AI to get to this point, but obviously to get wide scale adoption and sort of revolutionize the field, there's obviously gaps that exist to get there. So what's your view on what gaps are out there, and how do you address those?
I think there are a couple of gaps. First of all, generative AI is something that's been really hard for a lot of folks who are maybe not data scientists to get their hands around, because people are used to computer systems where if I put in 2 + 2 + 2, I get the same number every single time. And both the power of generative tools is the ability to act more like a human, like to be able to be empathetic, to be creative. But the fact that you don't get the same result every single time, and rarely you get things like hallucinations, that has sort of created a space where, after that initial excitement of AI that I saw sort of when ChatGPT came out, I've almost seen a backlash of a lot of even in the previous administration, like, okay, we're going to have more regulation around AI. We want to make sure that it's safe. I see that risk and compliance functions within health systems are getting really rigorous when vendors are coming forward with like their AI tools to make sure that they're operating. So what I'm trying to do is create a balance where we have to keep moving. I appreciate we have to be appropriately risk sensitive to these tools, but there was an article that came out recently around the ability of the newest version of the reasoning tool in ChatGPT to do the New England CPCs of the last 25 years. Those are hard. Those are cases I can't get. I'm an internal medicine doc. I do those cases to test myself. These models now can do clinical reasoning at a far better level than we can as humans. We've got to figure out how to deploy that to make it, again, cheaper, safer, better care for our patients.
Well, Jim, I'm gonna give you a little bit of a hard time here, in that I'm gonna say, look, your career, my career, Chris's career, we've seen a lot of things that are evidence-based that you and all of us would call best practices, but they don't get widely adopted because of the complexity of our healthcare system. And so at HonorHealth, I imagine you're facing a lot of the challenges that most provider organizations are. You're looking at, potential cuts in reimbursement with what's going on in Washington. So if you look down the next couple months, over the next year, and you say it may be challenging financially, do you think you're going to have the wherewithal within your organization to be continued to push by investing in AI and using these AI tools, or do you think that these financial headwinds may be even slowing down the effort?
That's a good question, David. My thought, one of the things that we're doing right now is we're trying to say, okay, we as an entire field have failed to leverage the efficiencies that these tools should bring. In parallel with that, we've had, like every system, process improvement functions that also have been trying to kind of create these efficiencies. Is there some way for us to create an internal flywheel at HonorHealth that is able to understand where efficiencies exist, like whether it's because of there's variation or just because there's just a lot of spend, or maybe revenue and cost are so out of balance, if we can make a difference there, it really improves the functioning of the organization, and do that in a data-driven way to then figure out in those spaces, let's be targeted with how we apply AI or other technologies to drive efficiency. And the other thing, David, that I'm, I don't know, haunted by on this, I think for us to be successful, you mentioned like healthcare systems haven't succeeded. I'm super aware that last summer in front of Kaiser Permanente, nurses were protesting saying AI, we need to trust nurses, not AI. And by the way, I believe that we should be listening to our nurses, our physicians, advanced practice providers, but they need to be a part of this solution so that we can take work that is burdensome to them, driving burnout, all these things. And so what we're working on right now is putting that together. How do we have frontline clinicians be a part of this process? How do we have process improvement be a part of this? And how do we have a data-driven approach to understand where the opportunities are? Because it's grounded in the technological capability. But again, another article that haunts me is doctors and nurses don't agree on if AI is going to be good or bad, but they all are very worried about the impact on clinical autonomy. And so we have to, like, to me, that's a hot button piece that we got to keep focused on, or else we're never going to make progress here.
Yeah. Yeah, that's a really great point. I mean, we've touched on a little bit the ethical concerns, right, that get created by having technology. How do you think about sort of the ethics of it in terms of allowing that autonomy, right? Decision-making support and bias and algorithms. How do you reconcile having care autonomy with AI being infused in whatever technology is being brought to the bedside?
Oof, it's an uncomfortable question, because I do think there will probably be some examples where we see that AI alone is better than nurses or physicians or advanced practice providers. Like there's some studies out there today. But coming back to what our patients believe and what our clinicians believe, I think just as a fundamental value today in our society, we are not ready for autonomous algorithms to be making those kind of decisions, just like we aren't ready for airplanes to be flown autonomously, even though the technology exists to do so. So I think that we're going to have to find how do we augment our clinicians, knowing we're doing a terrible job. Augment clinicians, which sounds great. We have to do a much better job of understanding the workflow of our clinicians and inserting AI at the right time to help them, because whatever we're doing today is probably not carrying that out. It's actually a really hard problem.
Jim, this is a series called What's Your Moonshot? And so, assuming that things go well, you follow the principles that you've outlined here of respecting the clinical perspective, but that you move this forward. What does 5 years from now look like in both your roadmap for clinical AI, but also non-clinical AI that improves the workflow efficiency of the organization?
Well, David, I would take it up to again, make this moonshot or a Mars shot even. Let's come back to, in the United States, we spend nearly 20% of our GDP on healthcare. That's money that doesn't go into education, infrastructure, defense, a bunch of other places that it could. And we get erratic outcomes. Like if you have cancer in this country and you have the means to afford it, we deliver world-class outcomes. But if you have a chronic disease like asthma or chronic obstructive pulmonary disease, we have terrible outcomes. Like, so we have this expensive system with erratic outcomes. Imagine if 5 years from now, we were able to drop the amount that we were spending on our GDP to 12%. I'm just making up a number. And imagine that lifespans went up. People had easier health systems to navigate. They felt more empowered by their ability to deliver care. And this coming wave of retiring baby boomers, we were actually able to care for with a workforce that is able to now expand to a much bigger place. I mean, that would be miraculous. And I think that's what we have to aim for, because we have more people coming who need care. We don't have the resources to do it today. If I get sick, I'm scared of navigating the health system. It's hard. It's a complex world, the financial space, the clinical space. So if we can make that much better for our patients and our clinicians, and we do that at half of what we're spending today, that would be a miraculous piece. That's a moonshot.
Yeah. Yeah. What do you think's the biggest challenge heading forward with AI? Like the one big thing you think we have to overcome for this to get more fully adopted?
I think a lot about there's so many companies that have come outside of healthcare into healthcare to try to reform it. Because boy, we need help. Like you listed everything out. We don't have it figured out. And yet I look at big companies like Google, Microsoft, Amazon, Walmart, right? And they come in and it turns out, it's really complex. It's complex because the regulatory environment combined with the financial model, combined with like the legal pieces, and then some of the technical debt. I mean, you put all those things together, it's almost impossible to like have any sort of viable system to work. So I think about that a lot, Chris, and I'm going to finish my thought, but repeat your question so that I can finalize the most accurate answer.
Yeah, no, I think what's the one biggest challenge to overcome with AI to get it to the point where it's in a place where it's useful for the masses?
And to me, it's that you look at trying to operate in a space with all of those competing constraints, and most health systems, not all, but almost all, not-for-profit ones, are running at about a 1% margin, right? So their ability to both invest and tolerate mistakes is very low. So it's this incredibly complex Swiss cheese thing that you have to get through. I often wonder if the breakthrough will come either in another part of the world that doesn't have that complexity, or at least somebody who isn't subject to the same regulatory constraints, right, that health systems are, may be able to innovate faster outside of that. And then the question will be, do patients like that? And then if patients get into trouble in that situation and then they end up in the health system, what does that look like, right? That'll be a fascinating piece in front of us.
Yeah.
Well, Jim, thank you so much for spending time with us today on What's Your Moonshot. I think all of us share your aspirations to create a more affordable, accessible, better quality health system, and think that technology's got to play a part in it. And we'll be watching you and cheering you on to help find and lead the way. But it's a big challenge ahead, but it's an important one. So thanks for sharing your expertise with us today.
Well, David, Chris, thank you for having me on, and maybe for the entire audience. I've had a little bit of a mission myself. Everybody that's in healthcare, we have got to figure out ways to achieve that moonshot. Our country needs it. And so thank you for giving me a platform to remind everybody we have got to keep looking for new opportunities to make things better for our patients.
Alvarez and Marcel. Leadership, action, results.